Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, Benefits and Risks of Opioids for Chronic Pain. Opioids, narcotics, are powerful analgesics, painkillers, that can be effective and safe when taken under close medical supervision. But they have side effects and can lead to addiction, so their use in the long-term treatment of chronic pain is somewhat controversial. /r/n/r/n Some opioids are derived from plants, some are manufactured in a lab, and others, such as endorphins, occur naturally in the body. /r/n/r/n Opioids are very effective in the treatment of severe pain. In fact, they are frequently used to treat acute pain, such as postsurgical pain, as well as severe pain caused by diseases such as cancer. /r/n/r/n There are several types of opioids used to treat chronic pain, and there are some differences between them. /r/n/r/n Variations include /r/n/r/n Another class of opioids, defined as partial agonists, combine medications that decrease pain with medications that decrease the potential for dependence. When the dose of partial agonists increases, the analgesic activity will plateau, and additional increases in doses won't provide further relief. These include buprenorphine and butorphanol. /r/n/r/n Many people with chronic pain can use the same opioid dosage for years without building up a drug tolerance or developing a physical dependence on the drug. /r/n/r/n Sometimes chronic pain sufferers who take opioids may wrongly be labeled as addicts, even if they do not meet the actual criteria for addiction. There is sometimes a certain stigma associated with taking narcotic pain medication, which can be frustrating for the person with severe chronic pain. /r/n/r/n However, dependence and addiction are legitimate concerns, and they can interfere with a person's life in serious ways. /r/n/r/n In addition to tolerance and physical dependence, opioids have a number of other potential side effects. /r/n/r/n These may include /r/n/r/n Often, healthcare providers will start opioid doses very low and slowly increase them until a therapeutic level is reached. /r/n/r/n Opioids tend to affect seniors and children more than adults, so these populations must be monitored especially carefully. /r/n/r/n Certain medications may interact negatively with opioids, so careful monitoring is required if you also take other prescriptions regularly. Be sure to inform your healthcare provider of any other medications you take, including those purchased over the counter, to avoid potential complications. Herbal supplements should also be discussed because adverse interactions could be possible. /r/n/r/n Alcohol increases the risk of confusion and sedation when used with opioids, and the combination can lead to life-threatening complications. /r/n/r/n Due to the increase in overdoses related to the use of opioids for non-cancer-related pain, the Centers for Disease Control and Prevention, CDC, have issued guidelines for the safe use of opioids in people with chronic pain. /r/n/r/n Recommendations include /r/n/r/n When an opioid overdose is suspected, naloxone hydrochloride should be administered as soon as possible to reverse the effects of an overdose. Naloxone hydrochloride nasal spray is currently available by prescription and over the counter, under different brand names. Prescription options include Cloxxardo, 8 mg/spray, Rixavi, 4 mg/spray, and Rezenapy, 10 mg/spray. OTC options include Narcan, 4 mg/spray, and Revive, 3 mg/spray. /r/n/r/n With so much controversy surrounding their use in chronic pain conditions, you may wonder why healthcare providers prescribe opioids at all. /r/n/r/n Simply put, sometimes the benefits of opioids outweigh their risks. Opioids are very effective at reducing severe pain, and many people who have not gotten relief from other treatments only find relief through opioid use. For many people with chronic pain, opioids can help give them back their quality of life. Negative side effects and dependence affect some people, but these issues do not affect everyone. /r/n/r/n Before prescribing opioids for you, your healthcare provider should do a full medical assessment, including a comprehensive medical history and physical examination. Some practitioners may begin with an opioid trial, gradually increasing your dose while observing you for potential complications. And you will have regularly scheduled follow-up appointments to monitor your condition. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.